as Kelsey said, this is going to be an infectious disease update, but the reason that the Department of Health logo is on my screen is because it's actually basically just a rabbit hole that I went down after reading one of the emails that we get. So we get pretty periodical emails from the Department of Health of New York State. Most of the times it's just like COVID epidemiology, flu, kind of like what the seasons are doing, but they also do some advisories for like diseases that are interesting and can affect our very international population here in New York State, specifically in New York City. So we'll get like advisories on like Marburg disease, Ebola. I think while conference was happening, we got one on alpha gal. So they're pretty interesting. I know I read them, Glazer reads them because he's the one that told me to start reading them. But there's some interesting stuff in these. But on March 2nd of this year, we got an email that read, advisory, New World screwworm outbreak moves into northern Mexico. And that's basically what my lecture is going to be about, which is the New World screwworm. Um, so I think to really talk about the screwworm, we should consider it in a kind of historical aspect. So the New World screwworm was considered a pest that's endemic to the Americas, and the United States Department of Agriculture actually did a really good job of preserving the history and documenting most of the history of the screwworm. So on the right-hand side, we actually have a picture of the two entomologists that were tasked in the early 1930s with understanding the screwworm and kind of eventually developing a way of hopefully eradicating it from the North America. So on the left is Raymond Bushlin, who was really tasked with understanding the screwworm and rearing it in a lab setting to be able to establish a pretty large colony for them to study. And then on the right is Mr. Edward Nippling, who was more tasked with like understanding the life cycle. And then together they developed the plan on how to eventually eradicate it from the North America. So this is a picture of what the distribution of the screwworm was in the 1930s. As you can see, it involves most of South America, Central America, the Caribbean, and it includes parts of the American Southwest, like Texas, California, Arizona, as well as Florida and Georgia. Um, this is the life cycle of the New World screwworm, also known as Cochleomya hominivorax. Homini meaning human, vorax meaning consumer, or as more commonly noted as a human eater. So what they found is that the life cycle is around 21 days. With adult flies, the male flies usually mating several times with females, and the female flies typically only mating one time before depositing their eggs around a wound or mucous membranes of a warm-blooded host. Now, those warm-blooded hosts were typically cattle or livestock, so cows, horses, goats, sheep, pigs. But as warm-blooded humans ourselves, we often also became a common host for these animals. Um, on the bottom right, so after around 12 hours, those eggs will hatch and they will introduce themselves into the wounds, and they kind of form these kind of like pillar-like uh, kind of projections where the bottom is kind of the mouth where they feed on. The difference between the screwworm and other flies like the blowfly or the flesh flies is that these maggots actually feed on living flesh, unlike dead flesh that the flesh flies or the blowflies would feed on. After about a week of feeding, they fall off the host and they go into the environment, usually into the soil, and then they become another adult fly to start the process all over again. So this is a picture of Herman Mueller, who in 1946 he's looking at a vial of fruit flies, but in 1946 he won the Nobel Peace Prize for discovering that ionizing radiation causes genetic mutations, and most of his studies was done on fruit flies. And what he also discovered is outside of the Nobel Prize winning discovery was that a certain level of ionizing radiation also caused sterility in fruit flies. And so, together with the previous entomologists, they decided to see if they can sterilize the flies with radiation. This is a depiction of one of them getting an X-ray. But really, what they came up with was the idea of the sterile insect technique. So, with Bushland's ability to raise or mass rear the screwworms, they were able to make millions and millions of worms and flies, and they were able to separate the males from the females and then expose them to ionizing radiation, which in effect sterilized the males. They would then expose those sterile males into the environment, usually by airplanes. They would literally just drop them into any environment that they wanted, or they would release them from the ground, um, where those males would then be able to mate with females, the wild females, therefore causing infertile eggs, which would then bear no offspring and hopefully overall reducing the wild environment and wild population of the insect. So in 1954, this sterile insect technique was first launched on the small island of Curacao. It was kind of like the ideal testing location because it was far enough from Venezuela, Aruba, and Bonaire that it wouldn't have a natural new introduction of screwworms. And it had a large cattle population, which was being affected gravely by the New World screwworm. And so what they did is they released approximately 60 million sterile flies a week onto the island of Curacao. And after 10 weeks, they determined that the island of Curacao was successfully eradicated of the screwworm. So with this success, the United States Department of Agriculture was able to obtain more funding, and they used the same technique in the southern part of America, which actually ended up extending into the East Coast as North Carolina due to the migration of cattle from Texas to the Eastern Coast. But by 1966, the United States was declared screwworm free, and those efforts moved further south. And by the end of the 1990s, all of Central America was also declared screwworm free because of the sterile insect technique. Now, that brings us to today. This is a logo of Copeg, which you can actually recognize was also part of that newspaper clipping from the 1960s. But COPEG is a commission between Panama and the United States on establishing a biological barrier for screwworms. So basically what they do is they established a lab in Pacora, Panama, from which they rear, sterilize, and release around 20 million sterile flies a week around the Darien Gap, which basically acts then as a biological barrier to prevent the northern spread of screwworms from South America. And this became basically the current distribution that we have now, with South America still being afflicted by screwworm as well as the Caribbean. But as you can see, all of Central America and North America has been basically screwworm free because of the sterile insect technique. Now, in 2021, the migration of humans began to pick up across the Darien Gap from South America, and with a peak around 2023. And the belief is that this new advisory actually comes from the migration of humans, but also the migration of small livestock, such as like sheep, goats, and maybe even pets like dogs and cats, which unfortunately broke through that biological barrier that we have and basically caused this, which this is the gist of the email from the Department of Health, which states that since around the late 2023, there have been a number of cases of the New World screwworm, 164,000 in livestock, and around 1,600 in people across Central America and Mexico, which were previously declared screwworm free. Out of those 1,600, approximately seven of those humans actually died from complications of the wounds and overall sepsis or infection. Um, and I'm going to show you some pictures of what these infections can actually look like. So I'm going to put a fair warning because it is kind of gruesome. The first one's going to be the worst, and then we'll kind of dial back. So this is the first picture. This is a gentleman who unfortunately is suffering from myiasis, which is the infestation of maggots or larvae at the back of his head. As you can see, it's usually several dozens, if not hundreds, of these worms that can infect the wound. This is a case study of a gentleman. This was a case study of several gentlemen who suffered oral facial trauma, whether it was a tooth removal or a surgical need from a facial trauma. And this is a case of oral infestation of the New World screwworm. This is a close-up of a 12-year-old female who, while traveling with her family in South America, got a pretty severe sunburn on her scalp, and then eventually those small wounds became a nidus for the screwworms. This was actually it was actually documented in a show called The Monster and Me on Animal Planet, and she had approximately 272 worms inside of her scalp that had to be removed. And this is the mild one. So this is a gentleman who also traveled and believed that he had a small mosquito bite. And it probably did start off as a small mosquito bite, but he was found to also be infested with the New World screwworm. So as you can see, it can go from pretty severe, like the gentleman with the thing on his back of his head, to something kind of like this, which I'm sure we've all seen the traveling patient who comes in for, hey, doc, I got this weird rash, and I was in, who knows, somewhere in the Caribbean. Um, and then back to the email. This is the kind of the last part of the email where it says, if you have this patient with New World screwworm, it is essential to remove, kill, and properly dispose of all larvae and eggs from the patients with suspected screwworm. Basically, because if we were to improperly dispose of it, it can uh, go into our environment and become a new nidus for local infection and spread. But it doesn't really explain how to get rid of it. The disposal is pretty easy. You put the worm in a cup, sterile cup, and you cover it with 70% ethanol, which honestly kind of reminds me of the moth worm in mezcal. But it doesn't tell you how to remove the worm. And so this is a cousin of mine. This is Santiago, and he's a zoo tech. That's why he has all these pictures with all these animals. And I actually asked him about it because this was kind of the rabbit hole that I went down with. And I was like, "Hey, do you know anything about this screwworm situation?" He's like, "Yeah, we he deals with it. And he's learned about it when it comes to livestock, but he's actually had a couple of cases of farmers and people that work with livestock that eventually develop small infections. And he's kind of learned some tips and tricks on how to treat it. Um, he currently lives in Colombia, Santa Rosa de Cabal, which is where we're originally from, which you can see is currently in the current distribution of screwworms. So what he basically described is that the screws tend to group together and like the pillar formation that we saw earlier. The bottom of it is the mouth hooks that they usually have, but at the top, the reason they stick out is because they have a respiratory apparatus, which is from spiracles which breathe air. And so he said that the best way to get rid of him is to cover it with some sort of ointment, whether it's Neosporin or some Vaseline, because it would cause them to look for air and come out of those wounds, therefore making it easier to pick them off. In the case of the young female that had the scalp worms, they actually just covered her scalp with Vaseline, like a thick amount. And as the worms would come out looking for air, they would get stuck, and then they would just wipe and put on a fresh layer of thick Vaseline. But this was his way of saying would be probably the best way of removing these worms. Now, in a case of like that gentleman with the large infestation on the back of his head, it might be necessary to get surgery involved or even plastic surgery, because of how much tissue damage has occurred. But something smaller like that gentleman, it might be something that just putting a little Vaseline and waiting for the worm to come out and then removing it with some tweezers might be just enough. The other thing to note is that sometimes you might catch the worm that has hatched, but there might be eggs that haven't hatched. So it's always important to have the patient come back for re-examination of that wound. And then finally, obviously, prevention is key. So to any of us that are going to be traveling, I just came back from Colombia not too long ago, but I'll be going to Mexico soon, and prevention is key. So if you are traveling, try to wear long sleeve shirts, long pants. If you do have any wounds, cover them and keep them dry. And then obviously the CDC recommends any insect repellent or zero point 0.5 permethrin to be used on clothing to kind of avoid mosquitoes that will lend to possible wounds, and then hopefully prevent the screwworm in the future. Um, any questions about the New World screwworm? It's pretty cute, not gonna lie.
So is it recommended again, even for adults, to use ivermectin?
So there have been studies of using like topical ivermectin on the wounds themselves, but um, the worms actually release an antibacterial uh component that keeps the wounds pretty clean and dry and kind of bacteria free. So they could keep feeding on living tissue. So the recommendation, there's not one from the CDC on what's the best way to treat it besides just physical removal of the wound and then treating any